G'day. Australia is open and it's yours to explore. There are cities to discover, stars to sit under, and there's fuzzy, furry, flappy, funny mates to meet. So it's time to dive in and pull up a seat, because stories like these just have to be shared. And all of this, and this. Yep, this is where you can find a story of your own. So book a flight and pack your bags, because Australia is yours to explore. Come and say g'day.
Here we are today to celebrate International Women's Day 2022, a day that celebrates the progress that we've made and celebrates women's achievements in different fields. I'm excited that across all sessions, we have some amazing women leaders representing government, industry, and academia. Men are an important part of the equation, the conversation, and today we have some remarkable male leaders who are strong allies for gender equality and experts in their sectors. As part of the Chamber's strategic vision to position the Chamber for profitable growth and expansion and to offer more value to our members, we are launching these 15 industry sector leadership forums in priority sectors. These are identified based on the India Economic Strategy, the Australia Economic Strategy, and of course, our Chamber membership. I'd like to say a few thank yous before we move on to the rest of the program. Thank you to the Australian Consul Generals, Ms. Sarah Curlew and Mr. Peter Truswell, Michael Costa, Deputy CG in Chennai, our co-chairs, Dr. Margaret Fo, Ms. Ravni Pava, and Dr. Ilavaragan. I would like to thank our supporting partners, Infosys. Special thanks to Deepak Padaki, who is also the Vice President of the Chamber and is present here today, and to Amar Harish. The Confederation of Indian Industries, CII, and Hindustan Institute of Technology and Science, who is the event sponsor. I would also like to thank Gayatri from Deakin University and Aditya and Ruben from our Chamber team. We'll now move on to the opening remarks, and for this, I'm delighted to invite Ms. Sarah Curlew, Australian Consul General for Southern India. Ms. Curlew is a career officer with the Department of Foreign Affairs and Trade. She has previously served overseas in Beijing, New Delhi, and Cairo. In Canberra, she has worked in a range of Indo-Pacific focused foreign and economic policy roles within the department, including on Australia's strategy for the Indo-Pacific and geo-economic issues. And with this, Sarah, I welcome you to present the opening remarks.
Thank you, Petula, and Vanakkam, everyone from Chennai. As Petula said, I'm Sarah Curlew. I'm Australia's Consul General for South India, and I'm very pleased to be here today participating on this panel and another milestone event for the IACC with the launch of the Health and Education and Research chapters. Australia's support for the rights of women and girls and gender equality is a central tenet of our foreign policy, our economic diplomacy, and our development approach. My foreign minister also held the domestic portfolio as the Minister for Women, and as such she puts great store on the events that we hold to celebrate and mark the contributions of women on International Women's Day, as well as to discuss some of the challenges that women still face in achieving leadership positions, some of which Petula outlined in her opening remarks. And as I was preparing for these remarks today and thinking of the contribution that we're celebrating in the presence of so many women leading in the health and education industries, I was struck, when I was a little girl, my grandmother would ask me what I wanted to be when I grew up. It's a pretty common conversation, right? And, the menu of options she would put before me, you could be a nurse, you could be a teacher, maybe you could be an air hostess. And of course, women working in the healthcare profession and in teaching are so valued, although we probably undervalue them in terms of monetary recompense. But it wasn't on the table that I could dream to be the head of a major health tech startup like Margaret is, or that I could be running the international office of one of India's most desired education providers. And I often say you can't be what you can't see. And so I'm really honoured to be sharing this platform with Margaret and with Ravni, because they are in themselves an inspiration for young women who are considering their career paths. There's a lot of prospective opportunities for Australia and India in both health sector and in education and research. Education has for a long time been one of the strongest planks of the bilateral relationship. We're very pleased that Indian students have been able to return to Australia. We're pleased at the strength of things like the Australia-India Strategic Research Fund. When I travel, and the High Commissioner and I were traveling last week together in Chennai and also in Kerala, there's so much appetite to do more with Australia on education and on skills and vocational training and on research. We are recognised as having a world-leading offering, but also one that is very appealing to India. On health too, I think we really started to find our niche, and I know my Austrade colleagues now spend a lot of time on digital health as one area that's very applicable. But we also have great examples like Macquarie University sending some of their medical students to be trained in India that bring together that health, education and research aspect. More broadly on the Australia-India strategic relationship, comprehensive strategic partnership, even in the year that I've been in this role, we've been able to see so much progress. And that's a year when we've suffered the Delta wave, the Omicron wave, so much disruption to travel and interaction. But the number of new initiatives that have been announced, the number of meetings that have nonetheless taken place, we had last year the first meeting of the Quad leaders, something that 5-10 years ago would have been impossible to even think of. We had the foreign and defence ministers travelling to India for a 2+2 meeting with their Indian counterparts. And that at a time when they had to do quarantine on return to Australia, it's such a strong signal of what commitment the Australian government has to advancing our relationship with India. Just last week, we had the first Australian Navy vessel returning to India for exercise Milan and Vizag. And I know that this kind of pace of engagement is just going to step up. Things very promising on the economic front too, the two trade ministers engaging very closely and very frequently with the aim of concluding the first phase of our comprehensive economic cooperation agreement, our free trade agreement essentially, and preparation is very far advanced for the relaunch of our India economic strategy in a sort of refreshed and updated version. Foreign Minister Jaishankar was in Australia not that long ago, and Minister Tien was here in India, and they between them announced a number of new initiatives around scholarships, around fellowships, around cultural partnerships, a new infrastructure forum. Actually, as a bureaucrat working on the relationship, it's almost dizzying. We've got so much new initiatives, so much new money to be programmed. And I think having a strong bilateral business chamber like the IACC with these thematic chapters gives us a base to draw on when we need to come to you to ask for advice and input on how we can be most effective with those new initiatives. It's one thing to announce them, but to design them and deliver them in a way that will really shift the dial on the Australia-India partnership is what we're all about. So thank you once again for having me today. Congratulations to the IACC for pulling together this excellent initiative. Particularly wonderful to be doing it around International Women's Day and to be celebrating those strong contributions of women in health and in education and research. Petula, did you want me to introduce the remarks now from our Ambassador for Women and Girls?
Yes, please.
So it is my pleasure to introduce remarks from Australia's relatively newly appointed Ambassador for Women and Girls, Ms. Christine Clark. Ms. Christine Clark had a long and successful career in our defence services, including commanding one of our Navy bases in Sydney. Now she's switched being a woman in uniform to a woman in diplomacy, advancing our gender equality and diversity agenda. And I'm very pleased that she's been able to speak to us today.
Thank you, Sarah, for the warm welcome and for the exceptional work of all our diplomatic missions in India. And as we celebrate International Women's Day, thank you to Ms. Petula Thomas, CEO of the Indo-Australian Chamber of Commerce, IACC, for your impressive work in reinvigorating the membership of the IACC to support more women business leaders. I'm thrilled to virtually attend today's launch of the new IACC Leadership Forums in Health and Education and Research, which has appointed 2 inspiring and successful women as co-chairs, Ms. Margaret Foe, CEO of Synapse Medical, and Ms. Ravneet Pawar, Deputy Vice President Global of Deakin University. These new industry forums will build on the shared commitments Prime Ministers Modi and Morrison made under the Australia-India Comprehensive Strategic Partnership to help both countries embrace technology to recover, modernise and expand our economies in response to the challenges of COVID-19. India is already one of our closest partners on science, technology and innovation. We have a shared vision for an open and resilient global technology marketplace, and we both want democratic norms and ethics to remain core to the next generation of technological advances. Increasing two-way trade and investment remains at the heart of the Australian government's plan to boost jobs, growth and prosperity in the region. So my heartfelt congratulations and thanks again to the IACC for cultivating the important industry, government and personal linkages that will spur deeper and broaden economic ties between Australia and India. We look forward to working with you to strengthen two-way collaboration in health, education and beyond.
Thank you for your very encouraging remarks, and I think the Chamber is always very, very pleased to partner and to have the support of the Australian consulate across all missions in India. We'll now move on to one of the important parts of this launch, which is Alan White, the Vice President of the Chamber, Deepak Padaki, to launch the Chamber's health and the education and research industry sector leadership forums, and hear from the three co-chairs. So I think Deepak doesn't need much introduction. He's a very familiar face at all our events and a very strong support to the Chamber. I will just say that Deepak, is also the Group Head of Strategy and Chief Risk Officer at Infosys. His responsibilities include longer-term strategic planning for the organization and the management of cross-functional strategic initiatives. As a Chief Risk Officer, he is responsible for defining the company's risk management framework, identifying and monitoring risks, to the successful execution of the company's strategies and operations. He wears quite a few other hats as well, the CII and the others. And with that, Deepak, please do the honors for us as Vice President.
Thank you, Petula, and good morning, everyone. Thank you, Sarah, for those opening remarks, and to Ambassador Clark as well. Like Petula mentioned, we'll try to get that video across in a short while. So over the last few years, I think the Chamber has really grown its membership to over 500 members today, and they come from a very diverse set of industries, both in India and in Australia. And one of the things that we thought we should do at the Chamber in order to increase our relevance to our membership base is to actually have sector-focused programs, right? So we had, like Petula mentioned, we have 13 to 15 sectors that we identified based on, the umbrella agreements between the two countries. And we felt that these sector-focused programs will provide a better platform for our members to interact, to share knowledge, and to actually, come up with new opportunities. And so it really is a privilege to announce two of these new leadership fora, one for health and one in education and research. As we all know, these are priority sectors, and they represent a very unique opportunity for both Australia and India. Both countries have built very credible expertise in these sectors. And obviously sharing knowledge and creating new opportunities in the sectors is a big priority. In fact, I think recently our Commerce Minister in India, Mr. Piyush Goyal, commented that the interim agreement that we hope will be soon announced between India and Australia is actually focusing also on new opportunities in these sectors. And like Sarah mentioned, I think even the Australian Foreign Minister launched the My3 Scholarship Program recently, which aims to I think fund almost $11 million to support Indian students to study in Australia's world-leading, well-recognized universities. And really, these comments are representative of a very strong commitment to strengthen ties between the two countries. So, officially on behalf of the Chamber, it gives me a really great pleasure to launch these two forums and to introduce the co-chairs, Synapse Medical Services, Deakin University, and Hindustan Institute of Technology and Science, All three are long-standing, very active members of the chamber. So let me say a few words about the chairs. Synapse Medical Services, of course, is a leading global medical administration company with offices here in India, in Australia, in Sydney, as well as in Dubai. And Dr. Margaret Fo, who joins us today, is the founder and CEO. Interestingly, she's a lawyer specializing in health insurance, in Medicare, and a registered nurse, Margaret, I think, as well. She's published in leading journals on the complexities in health financing, and don't we all know about that? She's very passionate about education, about using technology, and it really is our very great fortune to have her lead the Chamber's Forum on Health. Thank you, Margaret, for accepting that position, and we look forward to your leadership there. And for the Education and Research Forum, we have two co-chairs, Ms. Ravneet Pawar from Deakin University and Dr. Ilaragan from Hindustan Institute of Technology and Science. Ms. Pawar is the Deputy Vice President and Global and the CEO for South Asia for Deakin University. She has over 28 years of experience in international education and research. She's been very instrumental actually in the last few years in setting up a very strong framework between India and Australia around research in emerging and sustainable technologies. Amongst the many recognitions awarded to her, I think are the IABC Business Leader of the Year, and going with the theme of today, the Women Empowerment Entrepreneur Award by Asia One in 2021. She's been recognized as the top 10 women of Indian origin making a difference in Australia. So congratulations to Ms. Pawar, and thank you for joining us here and co-chairing the Forum on Education and Research. And Dr. Ilaragan is Director of International Affairs, Hindustan Institute of Technology and Science. He was the outstanding scientist and director for life sciences in the DRDO, the Defense Research and Development Organization, Ministry of Defense in the Government of India. He has more than 40 years of experience in teaching, in research, in technical coordination and management. I love this part that his interest in research is in high altitude stress, which you can read in many ways in today's world, I think. But he has several patents to his name, very well recognized scientist, and I think more than 85 publications in very renowned and refereed international journals. So welcome to our co-chairs of these forums. And now I'd invite them to come and speak about their vision and their plans and how they plan to take this forward. And I'm going to start with my really good friend and chair of the Health Forum, Dr. Margaret Fo. Margaret, over to you.
Thank you very much, Deepak, for that very warm welcome. It's an absolute pleasure to be here, an honour, in fact. Thank you also to Sarah and Petula and Ambassador Clark for those warm words and welcome. The UN Sustainable Development Goals have 17 goals to transform the world. The third goal relates to health and well-being, and that is underpinned by an ambitious target to achieve universal health coverage for all of the world's citizens by 2030. So in terms of what that means and my ambitions for this forum, the opportunities are endless. They will involve digital health, but also health education, practical exchanges of health practitioners between our two countries. But what we have is the position where Australia has a mature, successful universal health coverage system. India has a nascent universal health coverage system, but has made impressive gains, incredibly impressive gains in the furtherance of that ambition just in recent years with programs like Ayushman Bharat, which is the biggest universal single public payer system in the world, offering health insurance for 500 million people, no less. So what that means in terms of trade and commerce is there's enormous opportunities for our two countries, and my aim is to facilitate that. So these panels are a platform for our members to access sector-specific information. My sector is, of course, health. So it will be knowledge sharing, connecting businesses, but I also am keen to hear from our members. I want to know what they want in relation to possible events that we may hold for them to further the partnerships between health organisations in our two countries. I expect there will be a heavy focus on digital health, as Deepak has rightly said, and in fact one of the next sessions I'm hoping to initiate is digital health. So it's an honour to be the co-chair of the Health Leadership Forum. Thank you so much for putting your trust in me to do this, and I'm very excited to progress from here. Thank you, everyone.
Thank you, Margaret. Brilliant, encouraging, and lots to look forward to as always. We can't wait to the next initiative of the Health Forum. Ravneet, if you would like to go next, please, and then Dr. Illavaragan. Thank you.
Thanks so much, Pichula. Good evening, good afternoon, everyone. Honourable Ambassador for Girls and Women, Government of Australia, Ms. Clark, Sarah, the Councillor General Chennai, Mr. Deepak, Vice President IACC, and Chief Risk Officer at Infosys, Pichula, and others. A very warm welcome to you all, and also to the co-chairs, Margaret and Dr. Ilavagun. It's an absolute pleasure for me to accept the position of the co-chair of the sector for education and research. I've been working in this international education sector between India and Australia for the last 28 years, and I can tell you that it is ever exciting as it is now. This is a turning point in this relationship between India and Australia, and after 2 years, I am in Australia right now, given the sort of core of the pandemic. But I think I can tell you that there is a lot of energy in institutions wanting to engage with India. But not just that. I think education and research runs across all the 10 sectors of whichever strategy you look at, whether it's the India economic strategy or the Australian response to the economic strategy. It is indeed a privilege to be here and humbly accept the title. And I'm really looking forward to doing some work alongside my co-chairs. I'm incredibly grateful for this esteemed honor by the Indo Chamber of Commerce. In my view, the vision of Education and Research Forum is an extremely important one, because it not only explores who we are and what our stakeholders want, but it is also in our ability to deploy pathways and establish a very innovative ecosystem to support all the other chapters that you operate. So I think it's really important to have an underpinning of education and research, and this also sets the tone for establishing a strong connection for the future generations that will study in our institutions, in our countries, and the people-to-people linkages that this helps establish, whether it is in country or it is between our two countries. I think it's really fair to say that for us to move forward a knowledge-based economy, it is also key to look at the multilateral and the multidimensional partnerships that we can develop. And I think the sector is going to be supporting all of those initiatives, be it renewable energy, be it advanced manufacturing, healthcare, future infrastructure, or others that have not been mentioned. But I do think that all of these, including defense, I think in my discussions here, there's a lot of interest between both organizations to work in that area as well. All these are futuristic as well aligned in the India economic strategy, as well as in the UN Sustainable Goals 2030. So I completely agree with you, Margaret, that digital health is a key one. And I'm very happy to work closely with you in supporting it through the education and research lens as well. I look forward to engaging with all the members, colleagues, and agencies on behalf of the Chamber, and how we can develop a new education ecosystem to collaborate in areas of research with think tanks, industry bodies, companies, education institutions, and people. I think at the heart of it, of any relationship with any country, it is the people that matter. And I'm really looking forward to working closely with you. Thank you very much for your trust. And I really do want to support these initiatives as we go forward. Thank you.
Thank you very much, Ravneet. The Chamber has a very ambitious strategy for the next few years after the foundation we've built, and I think we definitely need the support of leaders such as all of you who are present here for us to get there together. So looking forward to all that the new education and research leadership forum will offer. Dr. Ilavargan, if you'd like to add anything else to Ravneet's. I think you're on mute. We cannot hear you.
Very good morning, good afternoon to all of you. Honorable Ambassador and the Consul General of Australia in Chennai, Mr. Deepak, the Vice President of the Indo-Australian Chamber of Commerce, and all the Ms. Petula and the co-chairs and all the participants. It is my great pleasure to be a part of this Indo-Australian Chamber of Commerce as a co-chair of the Education and Research Leadership Forum. It's an honor bestowed upon me, and I humbly accept the offer of being the co-chair of the Education and Research Forum. As we are all aware, India has a very big ambition of having a 5 trillion economy sooner. And the new education policy, which has been laid out recently, also gives a lot of scope for internationalization and having relationship with various universities abroad. And during this occasion, I would like to mention that the Australia having a very good developed education system, and India having millions of youngsters looking for good education, there is a lot of scope for this forum to work to establish collaboration and partnership between the universities in Australia and India, and in the areas of research, teaching and learning process, skill development, and so on. So this is a very good opportunity, and I would like to see that this forum helps in establishing a close partnership between the higher education institutions in India with those of in Australia. I would like to work for this jointly with Ms. Ravneet and the Chamber for this future. Thank you very much.
Thank you very much, Dr. Ilavargan, and I think we will look forward to working with you as well to take forward all the objectives of what the Leadership Forum will be looking at. I think we're running a bit short of time. It's with the launch of the two forums. We'll now move on to the health panel discussion, which is a great topic. Really looking forward to Dr. Margaret for moderating that for us. And I'd like to say thank you to Sarah Curlew and to Deepak Padaki for joining us for the opening session. We'll now move on to the health one. Thanks very much.
Over to me, Petula.
Yes, so with that, I think, Margaret, thank you so much for all these brilliant remarks. This is a great topic that you've picked, living with COVID. What does that look like? I'd now hand over to you to talk about, what the scope of the session would be, introduce the wonderful women panelists. Great that it's all women panel, and we look forward to the discussion. Over to you, Margaret.
Thank you very, very much, Petula. If my brilliant women panelists could now turn their cameras on. So Sylvia, Sumita and Veena, please pop your cameras on so we can see you. Thank you, everybody. When I was asked to prepare this session and it coincided with International Women's Day, I thought, well, I need to find some brilliant female panelists to be on my session. And of course, that was a very easy thing to do because there are so many brilliant women in health. I also wanted to find a group of panellists who spanned Australia and India. And so I'm going to introduce you to one Australian woman living and working in Australia, one who's living and working in India, but one who straddles both. An award-winning doctor who is actually originally from Chennai. I think that's right, Chennai. Samita, she can confirm that later, from Tamil Nadu. She now lives and works in Australia as a doctor in regional Australia. And I'll tell you more about Samita shortly, but she is an award-winning Indian-Australian doctor. So I've got a wonderful panel. I'm very excited. What we're going to talk about today is living with COVID. The title of the session is Living with COVID. What does that look like? And we will be looking at COVID from a few different angles. So what we decided to do is look at it from digital health. So look at it from the telehealth angle, where COVID plunged us quickly into online service delivery. And we have Sylvia who will be talking to us about that. But then we also had, a massive change in the pharmaceutical industry, which had to quickly pivot to, we're just making vaccines now. We have this new pathogen in our world, and it's a war, so we have to attack it, and the way we do that is with vaccines and medications. So we are going to be looking at COVID from that angle as well, from the pharmaceutical industry. And then finally, we're also going to look at what does it look like now? What does the future hold, and what is long COVID? Because what we know is that some people don't recover from COVID and go back to life as normal. It doesn't work that way for everyone. And we've got Samita here joining us, who is in her scrubs. I can see her there on the screen, in her scrubs from Orange Hospital, where she is running one of Australia's or New South Wales' most successful long COVID clinics. So without further ado, I'm just going to quickly, I'm going to read edited versions of their very impressive bios, because they're a bit long and we are a bit short for time. So I'll just take out the key elements of their bios. So first, Dr. Sylvia Pfeiffer. She is the CEO of an organisation called CoView. So her organisation CoView spun out of the CSIRO, which she co-founded with Nathan Earlman. CoView is a telehealth software company that has helped thousands of healthcare businesses deliver more than 6 million video consultations since the beginning of the COVID-19 crisis. Sylvia has more than 20 years' experience with web video businesses. She has a PhD in computer science, not surprisingly. She's worked in technology innovation with Google, Mozilla, NICTA and the CSIRO. She co-edited the standards that made video a prime citizen of the web and underpin not just the likes of Netflix and YouTube, but also CoView. She's got, in addition to a PhD, she's got a master's in business management. She's published 2 books on HTML5 video, and most recently one for healthcare businesses to help them set up video consultations. So Sylvia, very impressive resume, and thank you very much for joining us. Next, I'd like to introduce you to Veena Siegel, who's someone, my friend and colleague who I've known for many years, who I always describe when I'm introducing her as a walking encyclopedia of the global pharmaceutical industry. So Veena began her life as a qualified pharmacist, but she now has 3 decades of experience in the pharmaceutical industry, and that spans product manufacturing, regulatory affairs, market research, product planning, corporate strategy, product management, training, global sales and marketing, and global business development. She's recently authored an online course on brands versus generic medication. And she has a postgraduate degree in pharmacy. And her strengths include excellent organisational and interpersonal skills, communication, negotiation, entrepreneurial and interpretive skills. And I can attest to all of those skills. And then, of course, we have Dr. Samita Goundan, who is a rehabilitation physician. She's the head of the Department of Rehabilitation Medicine at Orange Health service. She's also a clinical lecturer at Sydney University Medical School of Rural Health and has an adjunct senior lecturer position at the School of Rural Medicine in Charles Sturt University. She's an honorary member of the Pain and Musculoskeletal and Disaster Rehabilitation Special Interest Group, and she's a member of the International Society of Physical and Rehabilitation Medicine. She's a passionate educator, but she's designed a novel rehabilitation pandemic plan and implemented a long COVID clinic. So we're going to talk to all of these wonderful women about these areas. So let's start. I'd like to direct my first questions, if I may, to you, Sylvia, because in terms of the way we'll progress from here, I think there's a natural narrative flow whereby we start with Sylvia and how she coped with her organisation had a meteoric rise in a matter of weeks in Australia as COVID hit. Then we'll look at pharmacy, then we'll look at long COVID. So a couple of questions first to you, Sylvia. So you might just take yourself off mute now.
Yes.
Welcome.
Thank you. Thanks for having me.
So Sylvia, my first question for you. So when COVID hit, it was March 2020 or thereabouts, your company, CoView, was at the forefront of the rapid switch from face-to-face delivery of healthcare services to telehealth in Australia. So could you share for the audience your story of that experience and any challenges you faced?
Sure. So it was March 2020, and my company, CoView, we had spun out of the CSIRO in 2018. So we had only just been, 2 years old, basically. But we had built great relationships, and we had a very big customer in a company called Health Direct. Health Direct is co-owned between different federal and between different state and the Federal Health Department, and has a platform called Health Direct Video Call, which the government, as the pandemic hit, encouraged to provide video telehealth as a platform, as a software platform to all healthcare providers in Australia. So that's through the Federal Health Department, that's the GPs and allied health providers and specialists, but mostly the general practitioners. And through the state health departments, that's public hospitals across several of the states, not all of them, but a majority of the Australian states. So that connection with Health Direct, who are using the software that we've written, as well as our own direct customers, which are allied health providers mostly, small businesses, 1, 2 people practices, maybe even 5 or 10 person practices. But you can imagine that that's the primary care market in Australia that's been picking up very, very slowly, telehealth as a functionality in Australia. And so COVID hit, and overnight people didn't want to be in the same room with each other anymore because of the challenge of infections. And that was the case for all healthcare practitioners across the board. And so on the 23rd of March in 2020, Medicare, the Australian government's reimbursement scheme for primary care and for healthcare practitioners to get paid for healthcare services, introduced Medicare items, for video consultations across the board, and that created a huge demand for video telehealth. And one of the providers was obviously us, and we had built great relationships with industry associations, and through our Health Direct connection, we suddenly saw an increase, and it went from about 400 consultations a day pre-COVID that we were doing. Within 2 weeks, we moved up to 25,000 consultations a day.
So
Wow.
it was a massive increase, a massive growth. And we're very proud that we managed to sustain our technology through that growth and to help all these healthcare practitioners, execute on the plans of the Australian government to roll out telehealth across the country.
What were the challenges, Sylvia? What did not work so well, and how did you overcome it?
Well, first of all, there was a technology challenge, just like every other video platform on the planet that includes Zoom and Microsoft Teams and Google. We had our outages as well because nobody was prepared for that kind of growth. Nobody can prepare their technology for that kind of growth overnight. And so we had a couple of outages, but we were resilient and we worked through them. We made sure that we were available, highly available for clinicians 24/7 as much as possible. But actually, the bigger challenge, I believe, was the human challenge, because a lot of practitioners were touching video telehealth for the very first time in their lives, and they had no idea how to do video telehealth. They had no idea how to hold a video consultation, how to even sometimes start a video call. So a lot of practitioners obviously picked up Skype and FaceTime because that was the easiest way for them. But a fair number also knew that they needed a clinically adequate platform that was providing security and privacy, and made sure that the consultation is a clinical context, so a clinical consultation, and you can do bookings, you can do workflows, you can get paid through the platform, and that's what we provided. So we had a huge run on our platform, and so the need for upskilling this amount of, it was 50,000 clinicians that wanted to be upskilled within 2 weeks, and I had a team of 7 people. So you can imagine the first thing I did was hire support people. So I hired 25, 30 staff within those 2 weeks just to help clinicians pick up video telehealth.
Wow.
It was a huge growth, and that was actually the biggest challenge.
Okay. Interesting. A couple of points there. So I think in another session, we will come back to cybersecurity in the context of digital health, because I think that's actually a very probably one we don't have time for today. But you talked about the regulated payment model. So Medicare is Australia's universal health coverage system, and it is we reimburse our providers in Australia on a fee-for-service basis predominantly. So how important was that, Sylvia, that regulated payment model in encouraging health providers to take up telehealth? Like, if that hadn't happened, what do you think the impact would have been?
So I seem to be having a little bit of internet problems. I hope you can still hear me.
Yeah, we can.
The biggest challenge for healthcare providers in moving towards uptake of video telehealth is that they get paid for the work that they do. And so before the pandemic hit, can you still hear me?
Yeah.
Yeah. Okay. So before the pandemic hit, there were only reimbursements, basically for a plan called mental. I can't remember exactly the name, but it was a mental health access.
Yeah,
Better access. That's what it's called. Exactly. Better access. It was for mental health consultations to rural and remote patients. And so psychologists and psychiatrists obviously were the key use case for video telehealth. And suddenly overnight, we were expecting general practitioners to provide video telehealth. And general practitioners were very interested to do this, but could not sort out the technology challenges overnight. So most of them went to do phone telehealth, which was also a reimbursed opportunity by Medicare. The biggest uptake by general practitioners was seen actually just last year in about July, when we had our 3rd wave of infections. And by that time, the clinicians were not only encouraged to do video telehealth by Medicare, but also had managed to sort out their technology problems. So in July last year, we saw a big uptake of video telehealth by general practitioners. It takes time to understand new technology. It takes time to understand how the reimbursements work. And only reimbursements will encourage a clinician or a healthcare provider in general to deliver services, because if they can't get reimbursed for the services that they provide, the amount of patients that is actually capable and willing to pay privately for such services is relatively small.
Yeah. So the regulated payment model, certainly in the Australian context, which is a fee-for-service payment environment, was critical. I just wanted to ask you one last question, Sylvia, before I move to Veena, which is you've talked a little bit about related topics, which are things like training. So training, it seems to me from what you've said, is critically important in facilitating the uptake of telehealth, and also a communication strategy from the government, I would suggest, or the sort of overarching authority, so that clinicians out there on the ground keep up to date and know what they're allowed to do and what they're not allowed to do. So can you make any comments on that, and what you see as the opportunities for the expansion of telehealth, perhaps not just in Australia, but globally? And what do you see as any barriers to uptake?
That's a very broad question. There's a lot of challenges. Payments certainly is one of them, and as you rightly mentioned, training is a big one. We've seen a very interesting development recently. About 70 to 80% of patients are very keen to use video telehealth and have expressed that through questionnaires that have been asked. Do this, maybe it helps a little. But clinicians are actually sometimes just finding it too difficult to do it. And so the clinicians are often the ones that say, oh, let's just come in person. Just in case I need to do a physical examination. So training and upskilling of clinicians is one of the biggest challenges to make this happen. I suppose the third component that I would point out is to also train staff. So staff across the healthcare systems, be that private providers, be that hospitals, public providers. Staff also actually needs to be supported, be that through training or be that through technology that can help staff in doing their jobs. For example, making the transactions, getting the payments, and making sure that regulatory requirements are met when they're doing telehealth. So there's a number of challenges involved in universal uptake, and I don't think we've seen that yet. We're starting. So obviously the pandemic has accelerated the usage, but I still think there's a lot more that we can do with virtual care.
Thank you, Sylvia, very much for your depth and breadth of experience and your valuable insights. I'll go now to Veena. If you are able to put your camera on, Veena, lovely to see you. So while companies like Sylvia's were making rapid changes in the way doctors and patients connected, the pharmaceutical industry was rapidly pivoting to vaccines and treatments. Are we going to immunise against this? Are we going to create treatments to treat this and cure this? Do we have to do both? In what order? Veena, my first question to you is, India is often described as the pharmaceutical capital of the world. The vast majority of the world's pharmaceuticals are manufactured in India. Could you just explain to our audience why that is? And are they all actually manufactured in India? Do ingredients come from other places and they're just put together, compiled in India? Can you explain that to us? And does that create a country dependency? If everything's made in India, is that a good thing for the world, or did that create risks because of a country dependency? So over to you, Veena. I can't see you at the moment. Don't know how you're going with your camera.
Oh, well, thank you, Margaret, for that question. And yes, my camera is on.
I can see you now. Thank you.
Yeah. So, yeah, you're very right when you say India is the pharmacy capital of the world. It's actually known as the pharmacy of the world. Because we are amongst the largest manufacturers And if we look at the export of drugs, we are number 7 in value and number 4 in volume for the finished dosage forms that are finished dosage forms, meaning the actual finished tablets or capsule or a vial, which is exported from India. And not to mention that India is self-reliant in the pharmaceutical industry for majority of the drugs, and while having a second largest population of the world to the tune of 1.38 billion there. Besides that, we have the largest number of the US FDA, TGA Australia, EU GMP compliant plants, and the technical manpower in India. They understand the regulatory requirements of the stringent regulatory authorities, and we have the maximum generic filings worldwide. And how it all happened based on the Indian Patents Act of 1970, which protected the industry and allowed it to get into the reverse engineering and working because big manpower of skilled staff. So,
just dropping out a little bit there, Veena. Your microphone, your audio is just dropping a little bit. I don't know if you can just get closer to your microphone.
Okay. Okay. Is that better?
Yeah. Just stay really close to your microphone. That's great.
Okay. So while we had this reverse engineering done between 1970 and 1995, India also signed the WTO TRIPS agreement and became a member of the WTO. Now, because of this reverse engineering and the special, facilities that we have, there were a lot of foreign collaborations which came into India. So we always, within the WTO TRIPS, we always had this provision for the compulsory licensing. But in India, what happened during the COVID times was that the voluntary licensing actions came into place. Products which are really well known in the COVID times, like the remdesivir, there was a voluntary license given by Gilead to 5 companies in India to manufacture the product, like Cipla, Dr. Reddy's, Jubilant, Zydus, Hetero. And because these, I'm just naming 2 or 3 products because these have become common names for common people who understand that these are COVID medications. Molnupiravir. Now, it's allowed by MSD Merck to be manufactured by another 5 companies in India. Baricitinib by Eli Lilly, another 5 companies. Covishield, the vaccine. AstraZeneca and the University of Oxford gave a voluntary license to Serum Institute of India to manufacture it. But what actually also happened was that there were many repurposed drugs which were being tried. Some similar simple products like paracetamol, hydroxychloroquine, a trump card of Trump, azithromycin, dexamethasone. Now, these are the products which were being regularly exported from India to various countries. And these are some very general products used on everyday basis by certain patients. But the shortages started happening. So while there was a dependence on these products on India for most of the countries, because they became COVID medications, the prices went up because each country wanted to keep this for their own. So that's a big challenge when you're dependent on one particular country. Now, also because India is also a major hub for exporting of APIs. Now, APIs of these very products were not easy to bring in because India is also dependent on the supply of the key starting materials, commonly known as KSM, and intermediates from other parts of the world.
Veena,
also on China.
I'm just going to have to, I'm just looking at the time, and we've actually are supposed to be finishing in 7 minutes, and we haven't even gone to Sumita yet. So I'm just going to have to, I'm so sorry, I will have to just rush us along a little bit. Can I just ask you, just one of the things I heard on, I think on my Twitter feed at one point, was that India vaccinated the population of Australia in 1 day. So they vaccinated 25 million people in one day, which is unfathomable in some respects. What were their challenges, because they were in Australia too, were there challenges in getting vaccines to remote communities?
Absolutely. But we also have to remember that India has a robust vaccine development program, which has been there, but it had to be multiplied because never ever earlier in the history we've had to vaccinate so many people at the same time, which was a challenge. Moreover, India had to work on the vaccines. I mean, like everyone knows that Pfizer was the first vaccine to come out, but it required a temperature of minus 70 degrees for storage. Now, to build up a chain like that would have taken some months, and maybe Pfizer would have worked with India to create that chain, but did all of us have that time? No, whereas we have the Covishield, which was being manufactured at Serum Institute in India, and it required a normal storage condition of 2 to 8 degrees. So, but we needed more cold chains. And for those cold chains, India went and also tapped the cold chains of the food industry. That was taken in. And then the distribution. So there were 4 depots which were used, which is basically in the metros in India, being a large country. These were they have the walk-in coolers. They were further supplemented to the 37 states, the union territories, and from there to the redistribution centers. And with that was also the training of the healthcare people. So it wasn't only the people who were always trained on vaccines. The new pool was brought in from the pharmacist to go to the interior areas. Additional training was classroom training, digital training started happening for the frontline workers. And then also we have something called the midwives in India who reach the interiors. So they were trained. And it's not just taking the vaccination there, the use, the communication of the vaccine program, and why is it required immediately and urgently for everyone. So while we were talking to Sylvia about the telehealth. India has 1.18 billion mobile phone connections today. So every time there was a ring on the phone, for the first 30 to 45 seconds, you would just hear a message that we are going through this phase of COVID, a pandemic, you need to get your vaccination done, you need to keep yourself safe. So you wouldn't just be able to connect to anyone till you heard that message, until you understood that message, till it was communicated to you.
Yeah, so, thank you, Veena. I will have to stop you there. I'm terribly sorry. We're just running a little short of time. But that last message that you've said is a very powerful message about the effect of communication, which is that when your phone answers, you got a recorded government message that you couldn't override. You had to listen to it. And it was a very effective way of getting a government message. This is the problem we're facing. We're having a pandemic. You need to get vaccinated. It keeps you safe. Here's why. And you disseminate that message to 1.1 billion mobile phone users. So, Veena, thank you very much. I am going to have to just move now to Sumita. Sumita, thank you very much for joining us from Orange Base Hospital. Now, after vaccines and acute illness, as we know, or as you know, it's not over for everyone. Some people experience a long-term illness after they've had an acute COVID illness. Could you just for everyone's benefit, because you're the doctor in the room, it will help all of us who are not doctors of medicine, could you just explain to us what is the international definition of long COVID? What is it? What percentage of the population are going to get it? And what are the most common symptoms?
Okay. Can you hear me?
Yes, we can.
So the long COVID terminology actually came from patients through social media. It wasn't a term that was described by the medical faculty. So patients started talking to each other in the social media saying that they are experiencing these symptoms, which is so non-specific. And after COVID, they still continued. So that's how the name long COVID came about. But the internationally accepted definition right now is called post-acute sequelae of COVID, which is called PASC, which essentially is long COVID, but this is what is more accepted definition. And this happens if anyone has symptoms beyond 4 weeks after their initial COVID or initial recovery period. We call that long COVID. And it can last from 4 weeks up to 6 months or beyond. And based on how they're having, whether it is a short term or long term, they described as PASC, short term PASC and long term PASC. So that's essentially long COVID. Now, the percentage of population who get the long COVID is a $1 million question, because there has been so many different contributing factors, the variants of COVID itself. We had Alpha, we had Beta, we had Delta, now we got Omicron. And also the patients who had initially the Alpha, Beta, and Delta were not all vaccinated. So they are the most patients who've actually had the long COVID. Right now with Omicron, it just started only in November last year. So we still don't know. The studies still need to emerge out of it. So the one really very good study that's been published in JAMA says, it's a systematic review. They've looked at 57 studies. 250,000 COVID patients were involved in that study. In that study was done around December 2020 to up to March 2021. So they were looking at more the Delta variant and the Alpha variant. In that study, what they've found out is more than half of the people who had COVID experienced long COVID.
Wow.
Symptoms up to 6 months. So that study looks a bit scary when you read it. But as I said, they were not vaccinated, so it was previous. And they've looked at every countries, and majority of the countries were developing countries, developed countries where the studies were conducted. So the other one, what you asked for, the common symptoms. Okay, the symptoms, they're huge. There's about 60 symptoms, and still people are reporting symptoms. It is a multi-system disease, essentially COVID. And the most common what people get is fatigue, feeling physical fatigue, physical exhaustion, and also mental fatigue, which people don't think much about. When we concentrate, we get tired. That's the mental fatigue. Shortness of breath, difficulty with breathing. They notice it more with activity. Some people experience chest pain, chest tightness, problems with memory, concentration, headache. They call it brain fog. That's a terminology patients use. They have a change in their taste and their smell, insomnia, unable to sleep. Some people, even within 24 to 48 hours, once they contract COVID, they're not able to sleep. And I have patients who haven't slept for 3 weeks. So heart palpitations, able to feel their heart beating so fast, and out of the blue, sleeping patients just wake up with severe palpitations. We can't answer why. Dizziness, pins and needles, joint pain, depression, anxiety, ringing in the ears, headache, diarrhea, earache.
Goodness.
So, yeah, you name it, this almost everything. And skin rashes, skin peeling, so many things that every time I do the clinic, I get, I find new symptoms. So this is what patients are reporting.
Wow. So, goodness me. And as you point out, we don't know what all the symptoms are yet. There's still new symptoms being reported because this is all very, very new. But look, so let's talk a little bit about how you're managing patients with those symptoms. So you established an award-winning long COVID clinic for us lay people, I guess that's what we call it, for Australia's rural population, especially Indigenous people living in your community. Samita, can you just tell us why you did that? Why was it necessary? What made you one day think, listen, I have to do something? All these people are reporting these symptoms. Can you just tell us about that?
Sure. So last year, August, our area was hit quite badly with COVID, and it just spread so fast, like we couldn't believe the speed that was going. And there was a huge proportion of Aboriginal communities were getting infected, and so fast and so rapidly. And generally itself, Aboriginal communities don't engage with healthcare much. It's very difficult to bring them into healthcare. We have Aboriginal workers working with them and developing rapport for them to trust in the health system. So I always try, I enjoy tele-rehab because I live in the rural area, and some of my patients are very far, even 7 to 8 hours away. For me to see them, I use tele-rehab a lot. So I have worked with the ambulatory care team, and they were actually looking at these COVID patients in the community. And once they get discharged from the hospital, they were discharging them from their service. So someone came to me and said that there's a 27-year-old Aboriginal man. He works full-time. He is 8 weeks post-COVID. He's not even able to get to the front letterbox because they had put food and things for him, and he wasn't able to reach it. Then she came and so she called him and found out that this guy was so weak and so fatigued that he can't do it straight away. And he's sleeping. He was sleeping all the time. So that's when I started getting more interest into it. And these patients couldn't travel. They couldn't come and see me. And then, the COVID, when you say COVID, people get scared. Even though they don't transfer COVID, the allied health and everybody didn't want to get engaged, and almost all the hospital, everything was shut for community patients to come and see inpatients into the hospital, or even bring them as outpatient, because that was a restriction. So this tele-rehab is something it was always my vision to have tele-rehab for the whole district for the patients on the whole, even before COVID. And this was a great opportunity for me to establish the tele-rehab. And so I started off setting up the clinic. And initially when I started, I didn't have physio, OT, social worker, clinical psych, or anyone. And I started off and I was everything. And plus I was actually trying to understand this whole COVID. And that time there was so much of literature. Things were there, but no one was believing it strongly. Even medical profession, we don't believe things so easily. So that was a huge challenge for me to even make my management understand this is real, and I'm trying to help these patients. And and then I just started, people started coming in, and it's become, it's quite a successful clinic, and it's a bit overwhelming because there's too many patients. And so that's how it started.
Yeah, thank you, Samita. Look, we could talk all day about COVID, but unfortunately, we do have to bring this session to a close now because we are bound by time, and the next session is due to commence 5 minutes ago. So. So apologies to everyone for going over time, but thank you so much, ladies. We could have talked much longer about this, and I'm sorry we don't have time to take any questions. But I hope that you have found the conversation valuable in understanding some of the challenges in the uptake of telehealth and digital health, and some insights about how to the learnings from the challenges that Sylvia's organisation faced to take into the future in India and Australia, and also Veena's insights into the pharmaceutical industry and the challenges not just of the uptake of telehealth, but also getting vaccinations, and then with Samita as well, the challenges of long COVID. There's a thread that goes through all of the three experiences that I'm picking up, which is communication. That people need to have very clear, reliable information that they can trust, so that they understand how to engage with telehealth, what a vaccine is, why they should get it, what is happening to them when they have symptoms post-COVID. So thank you very much, ladies and gentlemen. I'm going to bring the session to a close now and hand back to Petula, and just say that I hope that many of you will engage with this leadership forum into the future. We'll be looking at things like universal health coverage by 2030. Where are we up to? How are we going? We will also be looking at things like the governance around global health data and our digital health futures. So I'd like to say a very huge thank you to Sylvia, Samita and Veena. Please join me in thanking them. And I will hand back to you, Petula, and thank you very much, everybody.
Thank you.
Thank you so much. Thank you so much, Margaret, for moderating this very insightful session, and to the expert panelists. I think it gives us a wonderful preview of what this leadership forum is going to be doing in terms of knowledge sharing and other objectives that will be taken forward from here on. So thanks again to four of you for this wonderful session, and we'll now move on to the next one. Thank you for joining us. We'll now move on to our next session, which is building futuristic partnerships in education, skilling, innovation, and research. And before we start off, I'd first like to welcome and invite Mr. Peter Truswell, the Consul General, the Australian Consul General in Mumbai, to deliver his opening remarks. Mr. Truswell is a career officer with the Department of Foreign Affairs and Trade, and was most recently Deputy Head of Mission, Australian Embassy, Kabul. So he and his amazing team in Mumbai do a great job of strengthening the India-Australia bilateral partnership with Western India and Australia, and as well as the economic relationship. And we're so pleased to have you here. And I would like to invite you, Peter, to deliver your opening remarks for this session.
Thanks very much, Petula, and I hope you can hear me clearly. Yeah. Look,
yes, we can.
It's great to follow on from the excellent session that's just concluded, and to have the opportunity to make a few remarks to you before you start the next session. I think it's an amazingly good panel that you have, that Ravneet is going to be leading, with Sanjeeva, of course, from our High Commission in Delhi, Nikhil, who we know well, and many other distinguished panelists. It's also good to be speaking to you straight after International Women's Day, and seeing the prominent place of women leaders in these important areas of health and education, and the role of the chamber in supporting that. And I think I hope that this session on education, this industry sector leadership forum, which I greatly commend, will help us to find new synergies in education, research, skills and innovation, to progress the very important knowledge-based India-Australia relationship. And in Australia, in the Australian government, in the Consulate General, with our colleagues in Australia, in the High Commission in Delhi and elsewhere, we're very focused on finding new ways to work together in education, such as joint courses, collaborative research, and many other ways that we can pool the talents in our two countries. So just to start off with, I might just make a few comments about where we are. So Australia has a very long and I'd say distinguished past and tradition in terms of its education collaboration with India. International education more broadly is one of our great success stories. Over 3 million students from many other countries have been educated in Australia in the past 20 years. And what they do is they bring the necessary skills, cultural breadth, linguistic depth to our schools, vocational institutes, universities, workplace and communities. And Indian students account for around our second largest international student intake. In 2019, about 100,000 Indian students were enrolled in Australian universities and other higher education institutions. And thankfully, those numbers, at least from an Australian perspective, are recovering well from the very heavy impact of the pandemic. And as I think many of you know, Australia is open for business now. We're open to welcome students and the great contribution they make to Australia. But I don't want just to talk about Australia, because India has such a fine array of higher educational institutions, universities, centres for skilling, for leadership. And that's how India is capitalising on one of the great advantages of the country, which is its young, energetic workforce and its rapidly expanding skill set. And in this context, I suppose in this session, you might find time to talk about India's new national education policy. I know that this is an important mechanism to create new opportunity and to enable, in actually quite innovative ways, I think, the kind of creativity and interconnections with institutions in other countries, which is necessary, I believe. There can be few greater examples of complementarity than Australia and India, between our educational institutions, our research institutions. Just one example that shows this is the fact that more than 9,000 joint research publications came out of Australia and India in the period since 2017. And, so much is happening between our universities and our other vocational and other institutions already. There's more than 500, concrete institutional linkages, bilateral activities, policy exchanges. So it's such a rich landscape already, but that doesn't mean that there's not a great deal of potential to go further. And just to mention the role of the Australian government. So the Australian government, of course, is a big supporter of this key aspect of our strategic partnership with India. You'd be familiar, or many of you would be familiar with the well-established Australia-India Strategic Research Fund. That's been running for decades now, and it funds joint collaborations, joint research. And so many of these, papers and other things and research publications I mentioned are a product of the significant investment that we continue to apply to that. There's some other new exciting opportunities for joint research or business collaboration in cyber, in maritime policy, and many other areas, which I'd encourage you to keep an eye out for. And, one of the most important things that's happened in the last few years is what's called the new Colombo Plan. More than 5,000 Australian students have come to India to learn about India, to learn about synergies and ways to work together, to contribute to research, and to develop their own, personal knowledge of India and what it has to offer. And just briefly, some more support is certainly on the way. So the Australian government just recently announced something called the Maitri Scholarships Program, and that'll be at the cost of around 11 million Australian dollars, a way of attracting high-achieving Indian students to come to Australia and study at Australian institutions, focusing particularly on STEM and health. So, these will be well-funded scholarships that will really, I think, expand the breadth of our, academic leaders and business leaders of the future. So look, and so much is happening that the government isn't necessarily leading on between institutions. Between Melbourne University and Pune, the Melbourne Pune Academy is something that's been set up by Pune University and the University of Melbourne, and that's offering a blended BSc program. Then there's the IIT Bombay Monash University Research Academy, which is working in the field of PhDs, postgraduate study. The Bombay Stock Exchange is working with Western Sydney. There's so many other examples here, I can't name them all. But look, I might stop there and hand over to the panel, and I'm looking forward very much, I must say, to hearing the panelists speak about some of these issues. I think I might finally say that I think, COVID is, we talked about COVID in the previous session. COVID has been, a challenge and quite a traumatic thing for many of us, but it has opened up opportunities for new ways of working together. And I think I'd be interested to hear what the panel has to say about how we can capitalize on that in the future. So look, at this point, I might end my opening remarks and pass over to Ravneet and the other distinguished panelists, and I look forward to hearing what you have to say. Thank you.
Thank you, Peter, and it's an absolute pleasure to run this panel. And I think picking up from your comments at the backdrop of COVID-19 and the disruption it has caused to the sector, also, looking at the opportunity to look at the backdrop of the national education policy, I think it's really important to think about building futuristic partnerships in education, skilling, innovation, and research. Partnerships between India and Australia, I think, have existed for a long period of time in education, research, and innovation. But I think why we call this session is to think about futuristic approach to it, because the disruption has really been impactful. And how do we think from here on? What are the innovations that we can bring between the two countries really to take on further is the question that I am really looking forward to talking to my panelists today. In this session, we will discuss the emerging sort of ecosystem around education, research, skills, innovation that must remain top priority. My panelists will discuss on the possible unique and newer models that we can establish for engagement, and will guide using this as a base to the Australia-India relationship. The session will aim to trigger discussions amongst thought leaders across sectors on various strategic approaches to these interesting partnerships that we can help build between India and Australia. So without sort of taking on further onto this, I am going to introduce the panel. I've got Mr. Sanjeeva. He's from the Department of Industry, Science, Energy, Resources, Counselor to India responsible for energy resources and science bilateral cooperation. So a very, very comprehensive, a very interesting and a futuristic approach and title. Sanjeeva has served as a senior public servant, trade negotiator, international law advisor to the Australian government. He led investment negotiations for Australia in the world's largest regional trade agreement, and I'm really looking forward to talking to you. The next person on the panel is Mr. Nikhil Malhotra. He's the Chief Innovation Officer and creator of Makers Lab, a unique thin collaborative space with Tech Mahindra with over 20 years of experience. Nikhil has been a researcher all his life and is now leading the growth of AI, machine learning, robotics, quantum research with Tech Mahindra. So a fantastic contributor to bring in the industry insights into this, because I think without the industry, we are not able to lead the collaborative partnerships forward. The next person is Dr. Raghunathan Rangaswamy. He's the Matri Manurag Gurunath Institute Chair, Professor, Dean Global Engagement, and a co-member of the Robert Bosch Center of Data Science and AI at IIT Madras. As a Dean of Global Engagement, Raghu's focus is on enhancing the outreach of IIT Madras to universities in the corporate sector. And we all know in the rankings that IIT Madras has been at the very top end of India's collaboration with the world. His key work is around the areas of systems engineering, data science, machine learning, and artificial intelligence. The next person is Bhavna Chopra, needs no introduction for many players in the skill development ecosystem in India, and is currently with CII as a general manager and head skills. She was a core member and the original member of the NSDC team, and very happy to talk to you about the skilling aspect. So I don't think that we could have asked for anyone better on this panel. I'm absolutely excited, to see what justice I can do given the time I have. It is going to be a tight timeline, but I'm going to try and build some narrative around, what we want to do. And believe me, this will be the very first to the start of many interesting panels and interesting discussions, that we want to build. So I guess moving on, my first question really is around, for Sanjeeva, really talking to you about how we rethink holistic partnership story for India and Australia, and as it looks to position itself in the market within the backdrop of COVID, the national education policy, the renewed interest of Australia, India to work together. Where do you see the rethinking of a futuristic approach to the partnership? So just quick comments on that would be great.
Thank you very much, Ms. Power. I really appreciate being on the panel. So if I can choose an area that's very close to my heart in terms of that, answering how we're working on the partnership to position it for the future. Minister R.K. Singh and Minister Taylor recently embarked on a partnership on new and renewable energy technology collaboration between Australia and India. And in terms of the education and research component of that work, I see it, education and research as being critical in two respects. Firstly, in cracking the problems that we need to solve in order to address big challenges like affordable energy, like climate change. But secondly, on making sure that the opportunities of these new massive industries that are coming down the pipeline, that those opportunities are accessible to more and more people, especially in countries like India. So cracking the problem and accessibility are critical, critically introduce this education and research component. Just to give you a specific example, so if we look at solar, Minister R.K. Singh has anticipated that maybe $15 billion of investment will come into the Indian solar renewables market just this year. And Ernst & Young and others predict that India is probably the most attractive destination for renewables investment in the world. But if we zoom in, one area where India has solar, if we choose solar, has not, the solar deployment has not been as quick as other areas. India is deploying, for example, large-scale solar in a massive way. In the area of small-scale solar, it's been a much more difficult trajectory. And that the reason for that is multifold, but one of them is that you need many, many trained, well-qualified people in order to maintain these off-grid and small grid systems. So I've just started with Dr. Alan Finkel, who is our former chief scientist, has been appointed by our Prime Minister to oversee this work. I've started talking to them and our counterparts at the Ministry of New and Renewable Energy, as well as the International Solar Alliance, about how we can integrate education and training into our solutions around these really difficult questions, including energy access and solar access. So in terms, I don't want to take up a lot of time, but one of the things that occurs to me is that in India we have you have such incredible young potential talent that really is available to be deployed in these new fields and to take advantage of these massive opportunities. And from the Australian side, we have such a well-regarded, reputation as an education and skills provider. So one of the things that we're very early days, we're starting to discuss with our education colleagues is whether we can start to look at these kinds of frameworks, skills training deployed in specific areas like in solar and renewables deployment and PV manufacture. So if I can leave it at that, I'm happy to take follow-up questions. Thanks.
Thank you. I think it's very exciting to really hear you say that, because I do believe that, where we sit today, we do need to bring in government, industry and academia on the same page to look at real solutions and have impact to the societies we live in. And it's really important to help build the ecosystem in India, with the institutions offering the traditional courses that they do. Is there opportunity for Australian institutions to work with Indian institutions to build and narrow the skill gap, not just in India, but to support Australia and its initiatives as well? So I think there is a very sweet spot there that sits, which talks about how do we do this holistic partnership between academia, industry and government to support and underpin it. And I do think that the points that you make there, whether we pick up solar or we pick up, the focus on energy, how actually are we going to do this to impact the societies? And that's a very important part. I would be very interested in really understanding the areas of cooperation between India and Australia. And in your portfolio, you've got science, energy, resources. These are all very interesting and very comprehensive, focused areas. Of course, there is a gap in how Australia sees it and how India sees it. But what do you see your role going forward? What sort of support would you need to make this happen? Because this is going to be a challenging position.
It's actually fascinating. We are a very, very large and broad department, the one I represent here in New Delhi, and we have one Australia-based counsellor here, that's me, and a fairly small team of locally engaged staff. So early on, before I came, I spent 6 months just talking to all of the different divisions in Australia, trying to work out where there were small areas where I could make a difference from New Delhi. So I am not trying to cover all of those fields equally. But what I've tried to do is to spot the areas where really there is future opportunity that's untapped, and that we could just have a couple of key interventions. And, I came here and things are starting to unlock just in the last few months. We've had the first energy dialogue between Australia and India in 6 years, has happened in February. Ministers signed this partnership on new and renewable energy technology. And one of the other really interesting aspects that I decided to focus on was around critical minerals. India, of course, has a fantastic ambition around the manufacture of solar PV modules here, about the manufacture of lithium-ion batteries, for example, here in India. And the Australian government sees very strategic, very important geopolitical reasons that we would like to see India succeed in those ambitions. Now, one of the interesting things, though, of course, is that there are a few countries that dominate a lot of those supply chains at the moment. And it is very, very difficult to break in when you have countries that are dominating, say, 70 to 80% of the PV module space, and also can go all the way from extracting the minerals, the critical minerals, all the way to the, photovoltaic cell manufacturing, all the way to the module manufacture. It's very difficult when single players have dominated those fields. But one of the interesting things we have started is we've held fantastic discussions with an organization called Kabil here in India, which is and has a very vibrant, very, very good CEO named Dr. Ranjit Rath, who has become a good friend of mine. He has really spearheaded thinking into the future, because the reality is that the Indian ecosystem, if we looked at, say, batteries, the ecosystem here is not yet ready to directly receive Australian lithium spodumene or concentrate, for example. Yeah. It's not yet ready to directly receive our cobalt or any other battery materials directly. However, I can see there is fantastic work and investment happening, such that maybe in 2 or 3 years' time, that ecosystem will be flourishing here and very quickly become a massive market. So how do you bridge that gap? Well, Dr. Rath, thanks to his kind of foresight and our colleagues at the Ministry of Mines, we realized that there was actually an opportunity for a government-to-government collaboration. And I can't go into the details at this point in time. There are very, very interesting things happening, but it's an area where once countries recognize, as we did in our comprehensive strategic partnership, that there are strategic geopolitical reasons that we can't just go with the status quo as it's developing, that we need to start redirecting some of the energies of our, diversifying. We use the word diversifying some of our critical export industries. Once you realize that you are back in a world where governments have to roll up their sleeves and get involved. And so, it's just a fantastic time to be. I often feel like this with my jobs, that I land in an opportune moment, and I really do feel, and I've been so well welcomed by our Indian counterparts here, that I'm very excited about.
Fantastic.
Thank you.
Well, it is fantastic to have you, Sanjeeva, if I may say that. And I do think that, as institution providers, maybe on the representation of that, I might say that we are looking at coming along, on this journey with you, because there are lots of Australian universities, think tanks and industries that are very keen to operate collaboratively with India in the space that you mentioned, right from critical technologies to defense to clean energy and to smart manufacturing. Some collaborations already exist, but I do think that, given the topic that we are talking, futuristic, I do think that that approach really has a long way to go. And under your support, leadership, and I think the place where you sit, which is the conduit between industry and government, and how you bring the education institutions on that journey, which already a lot of fantastic research is going on in Australia. How do we actually support the India counterparts to help build that, and vice versa? So a lot of work is happening here as well. How does Australia look at capitalizing on that, I think, is a very important part. So I think that's really good. Thank you very much. I'm going to move on to Nikhil from Tech Mahindra. Nikhil, we see tremendous potential in technology and innovation, especially where we are entering an age where AI is going to be sort of providing all the great benefits. Some of the most notable and sustainable partnerships of tomorrow will require a paradigm shift in the way we interpret things today. So I'm going to sort of put my question across to you in a way to say, what is the state of play in terms of current models of partnership existing, with Indian industry and academia? And in your view, do these models really work? Do we need to rethink about how industry can play a role in supporting the education institutions? And what kind of futuristic models do you see coming out of this new phase of engagement?
No, fantastic. Thank you so much, Ravneet. I hope I'm audible. While Sanjeeva gets us the energy, we'll try and use that energy in terms of what we are trying to do with tech. So I think that's an important thing. But I think my let me start off by saying that COVID-19 has been kind of a chief digital officer for all of us. I think it's turned a lot of data scientists that are sitting around here into virologists and vice versa. And I think that's one of the vectors of change. But before I go into collaboration in terms of what we are trying to do with Australian universities, and I'm an alumni from RMIT. I finished in about 2001, 2002 when I decided to come back to India. Number one, I think, is the vectors of change. I think Sanjeeva pushed out on one end, which was energy. But I think from a tech player perspective and technology, there are three vectors of change that are happening in the world. Number one, you all know this, AI is changing. Everybody talks about AI, but AI would definitely change to how we can make it much more ethical, and also in terms of how we can be responsible. And as a result of that, models of neuroscience are actually being put into AI. That's one area where India and Australia needs to collaborate more in terms of research and development, but how do we take it forward? Number one. Number two, metaverse seems to be a buzzword at this point in time. And COVID has accentuated that metaverse system, and we should, that's another area, a vector of change for technology, at least, where Australia and India can work. Third, of course, we know you cannot build or you cannot find out new minerals and lithium cells unless you actually compute and have the computing power. And so quantum computing is becoming essential in terms of what the collaboration could be between Australia and India. And the fourth, of course, is the connectivity facet, which is either connection through space or 5G or whatever technology that we do. I think these are four broad sectors in which the tech industry is playing, and that is where collaboration would come in. Now, how do we collaborate? I think Australia, first of all, and I think I'll talk about both places at this point. Australia has got fundamentally very, very good research in terms of universities, but that research doesn't come out that often. And I think that needs to change. The way research gets published from US, Canada, and some of the other regions, Australian universities need to publish that research so that Indian researchers, Indian industry needs to see this as to what is happening. And I think that is one area where Australia can work out. Number one. Number two, Australia needs to see not just India, but Bharat. And innovation in India is not happening in India. It's actually happening in Bharat. And as a result of that, what Australia would get from Bharat is that fringe element, which would be taken into technology. And that's where industries like us are actually now going towards Bharat to look at where can we find that use case, where can we find that fringe, so that we can, push back to customers, obviously in terms of solutions, but also towards countries. And in a similar line, India doesn't not just need to see Australia. India needs to see the Australian countryside, where there may be an approach of STEM education or STEAM education, as we call it, where there's an approach of new people with new ideas, and what they want to do within the continent as well. The model that needs to shift seems, and this is my personal opinion, the model seems to shift from a platonic relationship. What we've been having at this point in time is an industry has some problem that it needs to solve. It actually gives in terms of mentorship, support, or consulting to the Australian universities, and Australian universities dive into that research to solve that problem. That platonic approach needs to be a much more hands-on approach. I think we need to have more exchanges between students, number one, which is obviously there, but also exchange between research and development communities in Australia and India to have a kind of more cohesive model and have a commercial gain at the end of it, maybe have an ROI at the end of it and not an ROI to start off with. I think that's the biggest change in the model that can produce a larger collaborative ecosystem between India and Australia. Yeah. Happy to answer any other questions.
I think you make very good points there. I mean, I really do believe that, there is a gap in how we can work with Australian universities, whether it is Indian industry or even Indian institutions or even Indian research institutions. And when you talk about Bharat, I completely agree with you. Australia has to think about Bharat and not India. And I think that the new ecosystem that's developing in our country here well, when I say our country here, I did mean India at this time. Sometimes I mean Australia. So, in India, it is there because it is very inviting, at the back of how change is going to happen in the way we do our research and the way we do education and skilling. So I completely agree with you that industry plays a role, government plays a role, but actually the work has to happen on the ground. And Australian institutions need to rethink about how they're going to approach India if they really want to collaborate at a deeper level to make a difference. And I come back to my point about impact. I think it is, at the end of the day, it is about impact, it is about making the difference, and it is about change. So very, very interesting thoughts from you, Nikhil. If you were to lead RMIT tomorrow internationally, what would you say for India?
Yes, my only thing is I will have RMIT students, once they finish their education, to actually come and sit and discover India first. Number one. A self-driving car works well in Australia, doesn't work well in India. You know the reasons. Energy works well in Australia in certain sectors, doesn't work well in India for certain reasons, and vice versa. I think what works best in India doesn't work well. The ethicality of technology also works very differently in two countries. If I was to lead RMIT, my first provision would be to actually have an exchange of ideas and actually a common place to sit and discover what can be done as use cases for both countries. Sydney today is reeling under pressure for water. India has a similar challenge with water in some of its villages. Can there be a substantial solution for both? Number one. Number two, Sanjeeva made a very interesting point about energy. Energy seems to be the core crux on what we are all living across and what we want to do. Can we do it in both places? India doesn't have a unified healthcare system. Australia has. But can that unified healthcare system be taken from Australia and pushed back into India? So the idea would be more in terms of execution. The idea would be more in terms of, traditionally, Ravneet, what we've done is we've believed that academia does the why and the industry does the what and the how. I think those lines are blurring. And I think one of my conditions for RMIT, if I lead, would be to actually say how these three lines are worked together in terms of both industry as well as academia. So academia doesn't have to only think about the why, but also what and how. And one of my roles as a chief innovation officer has been, well, think about the why within the industry as well. It's not just what and how. So somewhere a collaboration between those three terminologies or terms needs to happen from both ends.
I think it's very, very exciting. Very happy, Sanjeeva, if you want to come in, with a comment there. But I am looking at Peter here, sitting there in Mumbai. I do think that government has a role here to play, really, to bring in some high-level dialogues happening between Australian institutions and companies in India, really to think about the what and the how of a futuristic model of collaboration. It can be based around areas, it can be based around possible solutions that are going to impact our communities. It can be based around the new models that Nikhil has been talking about. And I completely agree that the blurring of the lines between what academia does and what industry does is at a threshold. And that's what the optimization for our sector is. with government playing a very key role around policy, which Sanjeeva talked about. But I think bringing in both academia in India, academia in Australia, industry in India, industry in Australia on a platform to solve real world challenges and problems. We may not be able to change the world, but we can make that difference, in key areas where we've got strength on both sides. So I think there is something that we could come up with through these discussions with such eminent people that I have on the panel today, and I'm looking forward to being a very integral part of that. Thank you, Nikhil. I will come back to you on a couple of other questions. I am going to move on. Actually, it's really injustice to give me such a brilliant panel and then to give me like 30 minutes to do this. I've already taken about 20 minutes already. So I think my third set of question really is to you, Dr. Raghunathan from IIT Madras. I haven't had the pleasure to meet you in person, but Deakin works with you, I know, and we are very keen to grow our partnership with your lovely institution. India joining the top 50 countries in the Global Innovation Index for the first time, moving up 4 places to the rank of 48th, keeping the leading position amongst nations in Central and Southern Asia, and ranking as the 3rd most innovative among the lower middle sort of income economy globally. India has the potential to actually become a research and innovation hub, I believe, with Australia as a critical partner going forward, I think is one of the key aspects that we could talk about. How do you think these models of collaboration between Indian industry, academia vary if you think more globally? I know you do a lot of work with US institutions and somewhere else in the world. What can India and Australia learn from your experience to set up really strong partnerships with industry and academia?
Thank you, Pao, for inviting me, and it's very fascinating to hear the other panelists' views. So, at IIT Madras, we have the research park. I think we at IIT Madras believe that the lines between industry, academia are blurring, and as was pointed out before. And I think one of the things that we are looking at doing, and which is what I was looking at what Australian universities are doing quite well, is to build the collaborations through academic programs. So there are programs where you have a project defined by an industry or a community, and then you have students participate, you have academics lead that project, and then that becomes well-defined, actually academic modules. I think that's a wonderful way in which you can actually bring in industry much more deeply with universities, and universities to really look at industrial problems much more carefully, students to be really trained in these problems and so on. So that's a model that I see quite a bit in the Australian universities, which I think is well worth doing in India. And I think we are doing that at some scale already. And as Dean of Global Engagement, one of the things that I've been trying to do is to really bring this partnership together, which is you have well-defined projects, challenge problems really. We have no dearth of challenge problems now in the world, with sustainability being a challenge, energy being part of that sustainability piece, AI being part of that sustainability piece, and so on. So how do we come up with challenge problems? Which you have a well-defined group of people working on that. So university from Australia, university from India, and a company or two from India, a company or two from Australia. How do you put these large, bright minds together that look at the toughest problems and solve them? So that's one thing that I think would be something that's very important for us to do. And we are doing lots of efforts toward that. We have started an energy consortium at IIT Madras, where we are trying to build this with multiple universities and industries and so on. So that's the broad answer to the question. But in general, I think when you look at industry academia collaboration, and in fact, think of lifelong learning, I actually believe I think the models are going to change. So for example, now a student comes into a university after 4 years, gets a degree, gets out of the university. But I think we should think of universities as a club, right? Once you get in, you never get out. Why should I check out of a university after 4 years? I get a degree, but I keep my connection with the university. And 3 years down the line, I want to do a special program with the university. I don't go through this laborious process. I simply come back to the club and say, hey, you have something that I would like to learn. So I really think this model where you think of education as a continuum from the time you get into a university all the way till you retire and beyond, you keep learning, is something that I think if you think about this, conceptualize this correctly, I think skilling, upskilling, learning now, all of them become the same thing. That is, you continuously learn. So that's an important thing also, I think, that we should think about.
Absolutely. And the point that you make about ongoing learning and the point that you make about, the lines are blurring, I think it's, if you want to give me an example of what IIT Madras may have set up in an area that, you have worked closely with industry and academia. Of course, I have been to your research park and it is fascinating to see that come across. But is there any one particular case study that you can share with us for the benefit of the panel and the participants, just to give us an idea?
Yeah, so for example, our flagship Robert Bosch Center for Data Science and AI, if you take that as an example, it was set up with CSR funding, but now it has become such a vibrant center that we are looking at AI problems from a purely theoretical viewpoint, from a purely implementation viewpoint in manufacturing, in health, and so on. And this center has multiple companies participating. We have multiple academics from all over the world participating. So what then happens is that it becomes a cauldron of activity where you can bring people in a more academic setting where the commercial aspects don't take over, but you can have freewheeling discussions, intellectual discussions, and so on. So in the area of AI, I think we have really made big strides through this Robert Bosch Center for Data Science and AI. We are trying to replicate that in the area of energy and so on. So those are two, I think, programs that I would say we have been trying recently, which have been very successful.
Fantastic. Before I move on to Bhavna and talk about skills, I want to leave my three panelists I've spoken to already with a thought. Is it possible that we pick up any one area that we are all passionate about? Maybe energy, I don't know. Maybe AI, I don't know. And could we continue the dialogue after this panel between us, with maybe Peter coming in from the government, to see how we can establish a dialogue where we can bring in institutions on both sides, maybe not all, maybe a couple of institutions that are doing good work in that area. We bring in some companies between India and Australia that are operating in that domain area, and how we can influence policy around the work that is happening between governments at this time as we speak. And we are hoping the pre-harvest will be announced shortly, as part of the free trade agreement. So I do think that if I can leave you with that thought, to say, is there something that we can co-create through this chamber panel and then take it to the next step and continue to have these discussions? Because I'm personally passionate about this area. I've spent 30 years of my work working in this area of collaboration, and I do think that we have something that we can almost create as a futuristic model. It is about people, it is about ideas, it is about making it happen. So in this room, we do have that capacity and capability. I'm going to move on to the last set of my questions, and which is around skilling. Skilling equals livelihood, equals futuristic part, equals next steps, as we all call. And India has a very strong upskilling agenda, and it is really, working very closely. I know that with Australia around framework, around, how we can work, whether it is with NSDC or accreditation bodies. With India's new education policy, significant skills demand and growth in India's education technology industry has opened opportunities for Australian companies and universities to partner on transnational education, content, product, and scale-up opportunities. The proposed mainstream of skills in NEP 2020 rekindle the hope to make education work-oriented and explore models of partnership to be more futuristic. And then COVID-19 threw up many challenges, which we all sort of dealt with, and it's a digital world that, you know, we speak, we are doing this forum digitally, but it may not be as effective in a room, but it is effective in hearing thoughts and views. Same thing happened to education and skilling. So my question really is a collaborative effort leveraging the strengths of the government, the private sector. Can we move this country, when I say this country, I mean India, towards a more equitable educational and skilling solution? Bhavna.
Thanks, Ravneet, for inviting me. And interestingly, I mean, I'm going to talk about what CI thinks about this. We are a founding member of this NSDC. And so let me just start off with that we need to change the context of skilling as well as what, you know, when NSDC was incorporated. I've worked over there. So maybe 10 years ago, the narrative around skills was around the entry-level workforce and the lower end of the blue-collar workforce. And it was very true, and it was very needed at that point of time. It was an imperative. But as we move on, I think we need to evolve and think about skilling and change the context about skilling as well. And that's what CI is doing. Because we are seeing that our industry members, and you know, we have 9,000 of them, are talking about future skills, are talking about the future of work, and there is just no talent to get in India. And that's where I see that, you know, the government is realizing it, and they are talking about, and whether it's a national education policy, whether it talks about embedding skills, it also, there's a lot of movement, not just at the central level, but also at the state level, the federal level, where people are talking, there are skills universities which are being set up. So Ravneet, more and more I'm seeing that there is a possibility of a public-private participation at a state level as well, with the skills universities and other forums, where the government gives out the funding or the infrastructure, but really it's for the industry and the academia to work together very closely. And whether it's an international collaboration or an Indian collaboration, but the industry needs to be and is willing to, Ravneet, at this point of time, is very keen on participating in the whole skilling agenda, because it's now a business imperative. It's no longer a CSR imperative.
Yeah. So Bhavna, if we were to pick up, you know, the narrative that you've talked about, what skilling means, and if you know, you do must know the Australian system that we operate, whether it's TAFE education or it is, you know, jobs of the future, as we talk about. I'm interested in your thoughts about where the gaps are in India working with Australia across those frameworks that it already has, to see what India can pick up as best pieces of that and sort of embed that into this public-private partnership model in India that can be established either with academia to academia, academia to industry, government playing a role, you know, as underpinning it. I still see there's a gap in that, and I think being in CII, you know, you would realize that the know-how of it doesn't exist for an Australian entity to think about how can we work in India in this area, how can we contribute. So if you just pick up any one particular area and one particular skill that we can add value to from an Australian prospect into India, how does one go about it?
Sure. So we did meet up with Mr. Matthew Johnston. He's the Minister Counselor for Education and Research just a couple of weeks ago. And what we've decided is that we're going to pick up two areas or sectors, so to say, where we are going to start the dialogue on. And one of them is renewable energy. It just so happens, and I'm glad to hear the talk around it. And now, here is where I'm going to go back to what Nikhil said, that unless the Australians, and that is the rigidity that has existed probably maybe 5 years or 7 years ago, the Australian standards on their own cannot work in India. We need to figure out and we need to sit together and study as to where the gaps are and where, so the Indian industry is willing to sit on the table and discuss with the Australian academia and the collaborators and the TAFEs of the world and say that, okay, where are the gaps and how do we implement this for the Indian ecosystem. And second, I think we need to also, so we've done this, Ravneet, very successfully with Switzerland for the EHL, with EHL Lausanne, where they have launched an 18-month Tibet course for the hotel industry in India. The training is being done by ITC hotel people, the staff itself. But the academia, the knowledge, the know-how, the learning platform is all provided by EHL. And SIA is doing the implementation, facilitation, and mobilization for around it. Now, this is a paid model, so it's fully sustainable, but it works at Indian prices. It cannot work at Australian prices.
Fantastic. Very, very exciting. And I think I'm really intrigued to know more about that and see how we can work more closely between India and Australia. I'm afraid I'm running out of time. I am going to go back to Sanjeeva for his comments and thoughts on next steps and you know, just any key comments you want to leave us with.
Thank you so much. So from a selfish perspective, the things that I would love us to work on is, you know, the specific thing I'm looking at trying to do in that new and renewable energy technology space is to bring Australian innovators and researchers that can collaborate with India, but also fit into those big manufacturing supply chains around solar PV and electrolyzer manufacturing in India. So if anyone on the panel or is able to give us advice on how would we structure that kind of interaction, what are the networks we have to be tapping into in order to know that we are covering our bases with the Indian research and opportunities here. Anyone who can help me with that would be fantastic. And similarly, on those colleagues that are in Australia, who are the Australian researchers in the area of solar, hydrogen, critical minerals that are interested, are showing a lot of interest in collaborating with India? I think I'm aware of some of them, but I don't want to miss anyone. Thank you.
Thank you. Fantastic. We can all make a note of that and continue the discussion. Nikhil, any thoughts from you?
I think all has been said, Ravneet. I think we need to get onto a dialogue table to understand what are the new models going to be. You know, like everybody said, India needs a very different perspective from an Australian side, specifically because of the language. And that is also the NEP policy. I think 27 mother tongues and 1645 dialects, we just don't speak English. We speak a lot of more languages, and maybe the education needs to change in terms of what we are essentially trying to achieve over there. And that's what Australia's point of view. From India's point of view, we've got to look at the Australian countryside and see how STEAM education can be built over there. Let me tell you, India on its grassroots is much more STEAM compliant than any other country because there are people who are actually fiddling with stuff. I think that is something that Australia can learn. And India can you know, partake with Australia. And what Australia can partake is how can we scuttle in the language sector within the Indian region, and that's where the combinations would happen.
Fantastic. And I will definitely continue the dialogue with you on the sort of industry, academia, research, blurring lines and how we play a role in that. So that will be very exciting. Dr. Raghu, yeah, so I think I've got the Dean from IIT Madras here. So if I can get Dr. Raghunathan here.
Yeah. So I think most of the points have been discussed. I really think the blurring of lines and how do we really leverage, it's a continuum in terms of research in academics and industry. How do we place what is being done in that continuum and then make sure that there is good participation from both sides. And that's been the challenge for years now, and I think things are much better now. I think with the kind of infrastructure that the Indian institutions are building, I think it's the right time to partner holistically, Australia industry, academia, India industry, academia, and go forward.
Absolutely. Looking forward to do that with your experience and leadership too. And thank you. Bhavna, last comments from you?
Yeah, so Ravneet, just happy to offer the industry. You need the industry members. We can get the CI platform. We use it to have and start these dialogues around whatever area, and especially energy, if that's an area we can pick up.
Fantastic. Thank you very much, people on this panel. It's been an absolute pleasure to host this panel, and I am looking forward to doing some good work with you into the future. Thank you very much. And thank you to my co-chair for being here with us today as well. Thank you for being a part of this robust discussion. Back to you, Pitula.
Thanks so much, Ravneet, and thanks everyone. That was, I think, one of the most brilliant discussions that I've listened to, commence, and extremely well moderated, Ravneet. As always, a fantastic job, and I think there's plenty to take forward too. And thanks again, Bhavna, for the one on CII's offer as well. I think there's much we can do with all partners working together. Thank you very much to the Consul General, Peter Trustwell, for being here, for your support, for your comments, and again, looking forward to working with you, the team, and the other diplomatic missions as we take this forward. I think we're a bit short on closing, so Dr. Elevaragan, if you don't mind, I think we'll have to just let this go, but look forward to you speaking at the next one. Just to say that the Chamber is coming up with launching our East India chapter in Kolkata in person on the 15th of March. And then we'll be looking at launching the Northern India chapter in Delhi, again, an in-person event, most probably by May. So with that, thank you very much from all of us at the Indo-Australian Chamber of Commerce, and look forward to being in touch again. Have a great day.